joining us today. I'm Jay Johnson, the state chair of the Virginia Organizing Project. We live in a country that cares deeply about free enterprise and competition, yet our healthcare system does not reflect these ideas. We stand here today on Enterprise Drive in front of the Chamber of Commerce to talk about the lack of competition in the healthcare industry and the consolidation that has only served to raise prices and make healthcare less affordable. The Chamber of Commerce behind me is the perfect backdrop for our event today because they are an organization that supports free enterprise and fair competition. We're here to support fair competition as well. We're here to release a report on Virginia's health insurance market consolidation that shows that two companies control 61% of the healthcare market in this state. This lack of competition in the healthcare industry is un-American and is costing us money and our wealth and our health. Last week, Healthcare for America Now released a new report that shows in the last decade, healthcare costs have risen 4 times faster than wages, putting small businesses and our families in a desperate squeeze. What is the cause of that rise? The insurance industry's monopoly. In the past 13 years, health insurance companies have merged with each other at a frightening rate, and now a small number of companies dominate local markets. Today, 94% of insurance markets in the United States have no meaningful competition. A few private health insurance companies have built a near monopoly in the Virginia market, burdening families and businesses with premiums that grow 4.1 times faster than wages. The state's largest health insurer owns a 50% share of the state's market. Without competition, insurers have no incentives to keep prices down and are free to charge whatever they want. And without choice, families and business owners can't pick an insurance plan that meets their needs. The negative effects of consolidation are more visible when viewed at the local level. In the Roanoke area, for example, the top insurer holds 95% of the market. If you don't like your coverage, options in Roanoke or similar areas, you have few choices. The limited healthcare industry competition across the state of Virginia is unhealthy for individuals, businesses, and the economy. Freedom from genuine competition allows Virginia insurers to reap oversized profits and raise premiums as much as they want. Health insurance premiums for Virginia's working families have skyrocketed, increasing 83% from 2000 to 2007. The cost of health coverage for a family in Virginia has doubled since 2000. There's a cause and effect relationship between the lack of health insurance competition and the meteoric rise in healthcare costs. We need to increase competition and get healthcare costs under control. The best way to do this is with a public health insurance plan. A public health insurance option would introduce a healthy dose of competition and force the private insurers to improve quality and price. We're advocating for a public health insurance plan that would give us all the option to keep our existing private health care coverage or go with a public plan. It's about companies competing and giving people choice. The business owners who make up this Chamber of Commerce beyond those doors understand the basic business concepts of competition and choice. Now it's time the health industry did the same. Thank you. I would like to take this opportunity to introduce our next speaker. Jessica O'Brien is an insurance saleswoman who works with small business owners and individuals. She knows firsthand why we need to reform our healthcare industry. Jessica.
My name is Jessica O'Brien and I live in Williamsburg. I'm an independent health insurance agent and I'm here today because every day I encounter people who I simply cannot help, whom I have to send away without a workable health insurance option. is a great need for real health care reform in Virginia and in our country. A public plan which offers good coverage at an affordable premium for everyone. It would go a long way towards improving our broken health care system through encouraging healthy competition in the health insurance industry. I deal with small businesses and individuals and work hard to make sure that my clients get the best coverage for their needs at the best price. More and more these days, I cannot find affordable insurance options for some of my clients. This is because the health insurance companies, in their drive for high profits, are able to cherry-pick only the healthiest people to be in their pool of the insured, charging those with health issues very high premiums or declining them coverage completely. While Anthem in Virginia is required to provide a policy of last resort where coverage is guaranteed regardless of health, that policy is very expensive and will not cover any pre-existing conditions for 12 months. This means that if my client has a health condition that does not allow him or her to get any other insurance, this policy is available at a high premium. However, any medical expenses for present health problems will not be covered. No medical bills will be paid for a year. 1 year of high premiums with no coverage for existing conditions. How is that helpful? How is that insurance? It's almost daily that I have to tell someone who comes to see me that their only insurance options will be out of their price range. And I know that when they leave my office, they will not find anything cheaper anywhere else. With no affordable option, they will essentially have to go without health insurance and hope for the best. I offer them the only other alternative, get a job that offers health insurance. There are many who believe that the uninsured in this country have simply not taken the initiative to find insurance or unwilling to pay a reasonable amount for premiums. Based on my experience, that's not the whole picture. I've seen many clients that want insurance or who have insurance and have received large annual rate increases. We spend hours together exploring options, but often they simply cannot afford the astronomical premiums. I work with many small businesses that want to do the right thing for their employees and provide comprehensive health coverage. This has become increasingly difficult to do. Small business owners make up only one part of the health insurance market. They are very often unable to offer the competitive health insurance benefits to their employees that the large corporations can purchase due to their size. One sick person in a business with 15 employees, even one sick spouse or child, can raise their rates to a level neither the business nor the employees can afford. My small business clients are struggling to hang on to their coverage, and I now see people every week whose employers have canceled their company health insurance plan due to the cost, and who are trying to find coverage on their own. In my years of witnessing the health insurance industry from the inside, it has become increasingly evident that the system we now have is not working for many people. A public plan that forces the private health insurance industry to be competitive may be our best bet. If we want health reform that works for us, can we rely on industry's own reform proposals that put their profits before our health? Comprehensive reform that includes the choice of a public health insurance plan will give people an alternative to private insurance and will challenge private insurance to change its ways in order to compete. I believe that everyone is entitled to health care. Having lived in Canada for years, I'm still amazed at the lack of affordable care in the United